Hi, everyone. This is Derek with OPTP, and welcome to our Next Level content series in collaboration with Evidence in Motion. Now, this content series is all about you, the clinician, and bringing you value in the way of education and inspirational stories that can help you take your career and your quality of patient care to the next level. Today, we're joined by Teresa Schuemann, who is in sports physical therapy for Evidence in Motion. Teresa, how are you?
I'm well, thank you.
Well, yeah, thanks so much for joining us today. Let's just jump right in with a quick introduction, and then we'll start with our questions.
Sounds good. My name's Teresa, as you said, and thank you so much for this opportunity. I am a sports physical therapist, and when I graduated from school, I graduated with a physical therapy and a certified athletic training degree, and then I kind of jumped right into acute care. Now I'm lucky enough to serve as the director of residencies for Evidence in Motion and the program director of the sports physical therapy residency program.
Perfect. Okay. Yeah, we've heard and seen great things, and I'm excited to ask you some questions today. I think we're going to start with just kind of a broad and general question. What is sports physical therapy? If you were to sum it up real quick.
Yeah, so when one graduates from an entry-level program, they are going to have their doctor of physical therapy. So they're going to be a great generalist physical therapy. And from there, a lot of people decide to specialize in one of the areas of physical therapy, and sports physical therapy is one of those. And so it really is working with athletes, and it's working along that whole athletic management. So really working with athletes for injury prevention, all the way through acute injury and illness management into rehabilitation. So if they happen to have an injury, you're helping them to rehab that injury, but then it goes a little further where you're really getting them ready to return to sport and return to performance, kind of in the spectrum, return to training, then performance and competition. And so you're really working with them all the way through. And then that performance enhancement piece of making them even a better athlete in any number of ways.
Okay, perfect. Yeah, and we'll get into more details with that in a minute here. But what inspired you to specialize or focus in this area?
Yeah. So it was a journey. When I graduated from physical therapy school, I didn't really know what I wanted to do. So I worked in generalist practice at a hospital in St. Louis for a while. And then I just found myself just having to pay attention to what did I really love to do and what was my passion. And no matter what division I was on, whether it was cardiac rehabilitation or rehabilitation with people that had spinal cord injury, I was always coming back to sport and trying to get them ready to go to sport. So I finally took the dive and decided to specialize in sports, and I went to a residency program. So that's how I got interested.
Okay. And throughout your experience so far and what you've seen with clinicians and other students taking your courses, how does learning with Evidence in Motion and specifically sports physical therapy help clinicians take their career to the next level?
Yeah. So with Evidence in Motion, I will say with the sports physical therapy content, we really pride ourselves on, like any course in Evidence in Motion, when you come to a course with us, we really want you to be able to go into your clinic on Monday morning and do the stuff that we practiced all weekend at the weekend intensive. And in order to do that, we really format our courses so that you have some pre-course work, that you get the knowledge base and the start of clinical application there. And then on the weekend intensive, particularly if you take a course with me, we're not going to be talking a whole lot. We're going to be doing a whole lot. And so it really is a lot of lab-based type things where you may watch the instructor give you an example of what we're talking about, and then you practice on each other. You have a partner. We switch partners up, so you get to practice on different size people because athletes don't come in all one size. And so it really, the hallmark is come Monday morning, we want you to be proficient enough to be safe and effective doing what we talked about all at our courses.
Yeah, that sounds sounds extremely interactive, engaging, and valuable. So what about on the patient side? I guess this will be a two-part question.
Mhm.
How does this coursework help a clinician take their quality of patient care to the next level?
Yeah.
That's what we just covered, of course. And then what about the patient themselves? Like
Mhm.
how have you seen this help patients? And I'll go one step beyond that, which is to please share your most inspirational story of a patient you've seen, overcome an injury, I assume in this case, and kind of the path they took from prior to seeing you to then, progressing.
Yeah. So one of the things that I think is really, really helpful is when you're taking courses, I always have this kind of thing in the back of my head where if I'm going to take a course for every certain amount of money that I pay for the course, I want to get something out of it that I know I'm going to use in the next couple weeks, and I think that that's really important to really make sure that you're getting what you want out of the coursework that you're taking. And for the patients, what's really nice, especially with these lab-based courses, is you leave the course and you're safe to do that technique, and you're not practicing anymore. You've practiced on any number of people in that course in order to get that technique or what you're doing to a level where it's going to be safe and effective for the patient that you're going to be with. And so for the patients, it's good because you're solid in when you're going to be doing these things. Probably one of the more inspirational things that I've really learned over my course of my career is that it's not about guessing. That especially with taking an athlete and putting them back into play, you don't want to be guessing that they're ready. You really want to have a systematic approach to, yes, they're ready. And whether it's return to sport testing with hop testing, jump testing, all of those things that we learn as we learn sports physical therapy, but you're going to be solid in performing them, but also interpreting them. And so really making a decision that, it's not, I think this athlete's ready to go back. It's, you're ready to go back. How are you feeling about your readiness to go back? Because you know, at the end, it is really the athlete that's saying, yep, I'm ready, and it's their confidence level. But by being very judicious and having a system where you're testing them and showing where their results are and then retesting them as they improve, that helps them with their confidence as well. And to address your other question, inspirational story, when you're really involved in your athletics at any level, whether you're in middle school, high school, professional athletes, that participation in sports becomes a part of you. And so when you have an injury, it can be pretty devastating. And I would say overall lesson learned is to understand that and then to be very optimistic about what is our plan to get you back. And the inspirational story I was working with a winter athlete who was a snowboarder, and it was very devastating when she tore her ACL because it wasn't the first time that she had torn her ACL, and she's just like, I'm done. And I said, that's a decision you can certainly make. I'm fine with that, but you're going to need to rehab this anyway. So let's just put that on hold and let's see how you're going to do. Let's rehab your knee, because you want to be able to be functional in lots of things. And so she played along. Part of it was because of just, trying to get her to understand this is your health also. And so she went ahead and dedicated herself to rehab, and we got there. And it was just so inspirational to see her turn with using really appropriate language and not focusing on being hurt, but this is an opportunity to get stronger, perform better, all of those types of things. And to see her really turn around, head back into competition, and have one of the best seasons that she's ever had. And not just from a performance point of view, but she felt really comfortable on that snowboard and she was having a lot of fun with it. And that's huge, especially at that professional level. you need to love it. You need to have a passion. You need to really want to do that to be able to perform at those high levels.
Yeah, that's one of the that's one of the things that I think is a very attractive to clinicians and fitness professionals who work with athletes is the sweat and dedication and passion they have for what they do. And I
Yeah.
assume it's a much different experience than working with just a general, pop individual who's coming in. But the story you just share with us, is this from the period of time when you were on the sports med team at the United States Olympic Center and International Triathlon Union?
It was. It was. And that one was with the United States Olympic and Paralympic Committee. That particular athlete was an athlete in adaptive sports. And that made it even more inspirational because you know that those athletes have gone through so much in their life, and they've had an injury that has made them re-look at their participation in sports in general. And then to be able to take their sporting background and then apply it to adaptive sports is so, so inspirational for all of us. And to see them jump back in and do what they need to do to compete at high levels in the Paralympic side of things as well.
Yeah, I can't imagine. So maybe we can expand on that a little bit from, individual patient focus to your biggest takeaway in general while working on the sports med team at the United States Olympic Center and International Triathlon Union.
Yeah, so in both of those instances, I feel really blessed to have been able to be with two fantastic sports medical teams with each of those organizations. And I think my biggest takeaway was really the realization of having a sports medicine team. You are a member of a team. You have leadership in that team, and it's always set up in the sense that that leadership just excels at making sure that every member of that team is working in their optimal and is a functional member of that team. And so if, yes, I'm a physical therapist and I'm serving in that role, but if one of the athletes needs help with carrying their luggage in because they're going to be doing their training session the next day, and we don't want them fatiguing themselves out just taking care of all their equipment and luggage, you're hauling luggage, up into the athletes' rooms and the area. And it doesn't matter who you are on that team. You all pull together to make sure that those athletes, the people that we're serving, are going to perform at their highest levels, whatever that takes.
What an experience. Well,
yeah, it's fantastic.
Well, thanks for sharing that with us. Yeah. Now, if we can shift our focus back to more EIM specific,
Sure.
A couple more questions for you. One, describe what it's like to attend an EIM course that you teach. I know you kind of did that a little bit before, but let's run through it again, what it's like to attend the course.
Yeah. So what's really good is even before you go to the course, like I said, there's some pre-course work. And so it's really fun to get into that pre-course work, and you're already meeting people and getting a feel for them even before you meet them face to face. And so you show up the participants show up day one, and, oftentimes I already am learning their names because they posted a picture of themselves, and now I can put that face with a name. And so you right away, you kind of break down that barrier of, yes, I'm instructing, and it's because of some of these gray hairs and I've got a little bit more experience, but we're all going to learn together. And that's what's really fantastic. And because of that pre-course work, they've already dove in, they know a lot of the information. And so it really can raise up to that next level of, how are we going to do this in the clinic? Bring your experiences to the table. What are you thinking? How are you going to do this in your clinic? And if there's barriers, let's talk about that. Let's see what those barriers are so we can break those down so that Monday, you should be thinking of 2 or 3 people that you can be doing these things on. So it's really just inspirational to me to see those learners take that step, right? Like, this isn't book knowledge. This is what I need to do. And it's really fantastic. By the last day, they're sharing experiences. We're all learning together, and it really becomes more of a group that has elevated their level of practice rather than one or two individuals here or there. It's all of us, and all of us are better for it having spent the weekend together.
Sure. Yeah, I think with that excellent answer, you already answered the next question, which was what
Nice.
motivates you as an instructor. I mean, it's clear your passion for it, and just the personal satisfaction you get out of seeing a group of people come together and learn to become better themselves. So
Yeah.
that's terrific. Is there anything else like to add to that? What
Sure. And
motivates
one
you
of
as an
the things that I
instructor?
really like is, when people are coming to the sports physical therapy classes, oftentimes they want to increase their sports physical therapy clientele. They're like, I'm working and I love working with athletes, but I'm only getting one to here. And what else is inspirational to me is hearing the stories after the course, because I always tell them experts do the basics well. And once you establish that you're doing those basics well and have a system to do this, athletes talk, word of mouth goes. And so you're not just seeing that athlete, you're seeing their teammate. And then you're seeing the coach. And then you're seeing the coach's wife. And then you're seeing, or husband. And it's just, athletes really do like to be, well, anyone likes to be treated well and actually hit those outcomes. But when you have that systematic approach and you've been practicing, it's also inspirational to hear those stories of, I've grown my sports population 10% because so-and-so sent so-and-so sent so-and-so. So that's the other part that makes my job very fulfilling.
Yeah, I appreciate you mentioning that too. Just basically connecting the dot between, okay, I'm going to make this investment into myself and my patients to, all right, now here we are. Here's the outcome, right?
Right.
That's
Right.
really exciting. Yeah. Cool. Well, here's our last question here. Basically, I think this one's more oriented towards the, students, maybe PTAs. We saw a lot of them at the recent combined sections meeting at through APTA, which was awesome, by the way. But what, with all your experience, what's one key piece of advice you give to someone interested in pursuing this sports side of physical therapy?
Yeah. Oh, great question. Thanks. So yes, we saw all kinds of students that are entering our profession. And first, I think it's just exciting to see it. And if they have to, if someone pins me down and says, "What advice are you going to give them?" I'd say, for me, my life changing or my professional changing issue was doing a residency program. And I don't know that every single person needs to do a formal residency program, but what was key to that residency program was the mentorship that I got. Really someone that was designated to help me. They invested in me. They gave me resources. They gave me their time. They gave me their friendship. And they also gave me their networking ability within our profession. Because when it comes down to it, sports physical therapy is not that there's not a ton of us out there. And so the networking opportunities and the investment in time from my mentorship was really key in me actually being able to succeed in this profession. And so for those out there that are looking to go into sports physical therapy, I would give the advice, consider getting a mentor, maybe through a residency. That was the best route for me, but certainly a mentor within the profession. And for those of us that are a little further along in our career, really think about paying it forward and being a mentor, because it makes all the difference to the outcome of our athletes to have people doing the right thing at the right time in the right way. So everybody benefits from that.
Perfect. Yeah. Well, awesome. Wonderful, insightful answers, Teresa. Really appreciate your time. That's going to kind of round out our questions here. I do just want to direct people, those of you who've stuck with us for this long, to Evidence in Motion, of course, to learn more about all the courses that are available, not only under the sports physical therapy umbrella, but there's many other subcategories that are offered. under the, post-grad programs and courses and certifications. And is there anywhere else that you would like to direct people to, Teresa, to find your content and your coursework specifically, or others that you might suggest under the sports physical therapy umbrella?
Yeah, so under sports physical therapy with evidence in motion, we have actually broadened our target audience, but also our content in order to really capture sports medicine. And so there's content out there that's for certified athletic trainers. There's content that for the physical therapy assistants who want to specialize in sports. And so if you have any trouble finding it, feel free to reach out to me or info@eimpt.com asking about that, and they will forward it on to me. So yes, take a look at it all.
Excellent. Yeah, and I've got to do a little plug for OPTP as well for those of you
Yes.
PTs and professionals who need equipment to treat your athletes or general population. Of course, we can take care of all of your tools and things you need to accomplish that effectively with kind of top quality equipment across the board. So definitely check out OPTP as well. But Teresa, I'm not going to take any more of your time today. Really appreciate everything. And I think we're going to sign off here. Thank you again. And thanks everyone for watching. We'll see you next time.
Sounds great.